So glad that you are here. Welcome to our webinar today, everybody. I'm Amy Stafford, president of Body and Soul Fitness, and I'm super excited to introduce you to Dr. Saundra Dalton-Smith and also Dr. Liz Berbano. They're going to talk with us today and answer a whole lot of our help I'm ... questions that have to do with us as women generally. So welcome from Texas and Illinois. We've got Oklahoma as well. So give you just another moment and we will get started. So as you're just entering in, please open your chat box and let us know from where you are joining. Welcome, Kate from Zimbabwe and Julie in Minnesota. One more housekeeping, and South Africa. I love reading where they're from, you all. I can't even think. I'm so excited. Nigeria, excellent, in Massachusetts. As you have questions for Dr. Saundra and also Dr. Liz, if you would put those in the Q&A. So also on the bottom of your screen, you'll see a Q&A double bubble, and we'll be tracking that as well so we can answer your questions as they come in. So doctors, I say we begin as we continue to welcome everybody in. For those of you that are joining that may not be familiar with Body and Soul Fitness, we are an international nonprofit faith and fitness organization. So this fits into the fitness part, being well from the inside out, not just with exercise, but also with diet and monitoring our bodies physically. So Dr. Saundra, if you would begin, tell us a little bit about yourself and maybe just pick a question you'd like to answer off the top.
Yes, I'm an internal medicine physician out of Birmingham, Alabama. Mom of 2 boys, married for 20 years, author and speaker. And just picking a question off the top, I would probably say the one that hit me first was the one about what are some ways we can remedy adrenal fatigue, specifically because a big way of remedying that is with stress management and learning how to rest and restore our bodies so that we are decreasing the amount of cortisol that we're experiencing, which, as you know, as some of you may know, I'm the author of the book Sacred Rest, which is what that talks about. I feel like the majority of our population is chronically in a level of adrenal fatigue. Now, I do realize in the medical community that term is somewhat controversial as to whether or not it's an actual thing, but I think we can all agree our stress hormones are staying higher than they ever have because most of us really do not have any type of stress management, so to speak, or restorative self-care practices that we do effectively and on a regular basis. We typically do them after we have already burned out or we're already at the point of feeling like we have adrenal fatigue. And so that's one of the main remedies is really learning how to regulate your own cortisol level and the things that you can do to decrease that. And some of those are hard choices, like cutting back on the caffeine, not so much coffee and, teas that have caffeine in them and sodas and those kind of things. Other things include making sure you're getting to bed at a decent time and not staying up late trying to fit in all the things that you want to check off your to-do list, making sure that you're not overloading your schedule, so that you always feel like you're in rush mode. So some of those require some healthier boundaries, personal boundaries, just to make sure that your adrenal fatigue is your adrenals rather, are able to recover throughout the day.
Excellent, excellent. Dr. Liz, could I ask you to maybe ask Sandra a question, some of those that came in, and as you all are live attendees, do use that Q&A box as you hear the doctors talk about things and it leads you to another question. We'd love to hear from you.
Excellent. I completely agree with what Dr. Sandra said. And, I really do think, as you said, in terms of one of the epidemics in our country is stress management along with sleep deprivation, getting the good quality of sleep and not just the quantity of time that we lay in bed. So all of that is fabulous. So going to another question that came in from our folks, what are some natural ways, Dr. Sandra, to balance hormones that cause weight gain and weight loss?
Well, I think we talked a little bit about cortisol. I think one of the main ones that you really have to be mindful of when it comes to your weight is your insulin level, because that's one that you can manage. thyroid has an effect, obviously, on weight loss and weight gain, but that's really more of a medical area where you're going to need to actually have testing, find out if you're hypothyroid or hyperthyroid. So that's one you can't personally, I would say, manage yourself. You really have to have a medical profession to kind of help you evaluate that. However, insulin is something that we do have a very high ability to be able to manage the levels of, really dependent on what we're eating, how we're eating, and those types of things. For example, if you're someone who finds that you have an affinity for all things carbohydrates, you like the breads, you like the sweets, you like the chips, all of those things, the highly sweet fruits, those are your favorite go-to things when you're needing energy, what's happening during that time is you're spiking your insulin level. And high insulin levels tells the body to hold on to food. So that nutrients that you're getting from whatever it is you're eating is all trying to go somewhere to deposit itself, because that's what a high insulin level triggers the body to do, to hold on to energy stores. However, if you transition that into a lower carbohydrate diet and more whole foods, things that are not so overly processed that will increase the insulin level, that insulin stays lower and it stays more stable. You don't have these peaks and valleys. And so if you're able to keep your insulin level stable, then you decrease not only your hunger, which would help you lose, but helps with weight loss, but it actually decreases the body's desire to cling to the nutrients that you bring in. It holds on to the things it needs, the vitamins, the minerals, all of the proteins, the amino acids, all of those things you need from the food, but it doesn't hold on to all of it. It gets what it needs, and then it releases the rest. And, we talk a lot about calories in, calories out, and that's important. Don't get me wrong. That definitely is part of the weight loss equation. But, I find sometimes when I'm working with patients, particularly younger patients who, they want to try to still eat these really high carbohydrates, fast food kind of diets. And they're like, well, I only got, 1,200 calories that day. Why is the weight not coming off? Well, if the 1,200 calories is coming from, a fast food meal that is very high processed, high carbohydrates, spiking your insulin level, you're actually working against the calorie in, calorie out. You're bringing the hormones on top of it, which are going to actually be more effective than just the calorie in, calorie out. And I think that's why people sometimes get so frustrated. It's like, well, I'm only eating this amount of calories, but they're not actually taking into account the hormones that are in play during that calorie exchange, because that's what's actually going to control what your body does. Your body's going to obey, so to speak, the hormone that is in greatest effect within your body.
Excellent. So that's another example of quality versus quantity. And we may touch on it again, or you may touch on it again with regards to sleep, but quality of food rather than quantity of food. And then we use that term in medicine too, glycemic index, when we're talking about food. And foods, if folks looked up glycemic index or the list of them, high glycemic index foods are the worst, being more processed. And they spike insulin very quickly because they're absorbed very quickly. And I always tell patients too, on that list at the top of high glycemic index, white bread, 100 points. So you want low glycemic index foods, as Dr. Sandra talked about, those whole food plant-based.
That's such a great point, because, I think sometimes people actually aren't aware of what foods are on that on a higher index. And honestly, sometimes some of the foods that are healthy can be higher index. And so if you're someone who your physician maybe has said you are pre-diabetic or borderline diabetic, or something like that, it's like they're not telling you you're diabetic, but they're letting you know, you need to look out for this. You need to be aware of what your glucose intake, what your glucose index is, and the foods that you're eating, and you need to be aware of kind of how you're consuming foods, as you mentioned, the quality of the food that you're eating. Sometimes I find that patients I'll take a look at their numbers, and they're really doing good. They're staying away from the breads and the yeast rolls here in the South, and the cornbread and all these things that spike up the levels. But then when I look at their food log, which is something I often ask patients to do, I'll see things like their primary fruits that they do as their healthy snack are grapes, bananas, and pineapple. which although they are fruits and they're good and you can have them in moderation, but if that's the only fruits you're eating, all of them are higher on the glycemic index than, let's say, apples or pears or things that actually have more fiber, because foods with more fiber tend to bring down that glycemic index. Your body doesn't process it so fast. And as Dr. Liz says, if it processes fast, it's almost like an instant insulin spike. It's like, oop, jump up because it went through too fast. So, that's the thing. We really should, if you've never done that before, just Google it, to be honest with you. You'll probably get 15 different charts of foods, but just find your favorite one and just, for a week, start looking at it. When you decide that you're going to eat something, even something you think, I know this is good, God made it, it's good, but you have to be aware of your body. Because because in my family history, my dad's diabetic. So I have to be aware that I have kind of a family history of that. So I'm really cautious about eating foods, even fruits that I know are good for me, that are higher on the glycemic index. And in general, if it's white, it has a tendency to be higher. White flours, white breads, white rice, white sugars, all of those things have a tendency to be higher versus like a sweet potato or brown rice, those kind of things that have more fiber. As I mentioned, if it has more fiber, it's more likely to be lower.
Excellent. That white food tip is a quick one in the office, and I've shared that with patients. You mentioned another thing. This is a loaded question, and it is a great question. So that's why we're kind of dwelling here, because natural ways, things that we could do. And you mentioned about fiber, and I'm married to a wonderful gastroenterologist, and he always reminds us, and that's why I think it is a good tip that you gave about looking at the list. Fiber slows absorption of those foods in order that we don't get that spike. Natural way, is this a good spot? Because a natural thing we could also do to just talk about sleep and how it affects insulin resistance and insulin sensitivity, because it does quality.
Yeah, absolutely. You mentioned something about sleep also being not just the quantity of sleep that we get, but the quality of sleep that we get, and, when you look at the sleep research, sleep has many different stages to it, especially the non-REM version. So non-REM sleep ranges from stage 1 up to stage 4 in most studies. And so when you're looking at that, stage 1 is that very light sleep, where I oftentimes relate this to if you've ever had a child before. So stage 1 is like the baby rolls over in the bed and you're awake. I mean, it takes nothing to wake you up. Stage 2, the baby has to cry first, like this, but the second that cry comes out, you're awake. So you're a little bit deeper than stage 1, but you're not up to stage 3, which is where the baby has to like scream and cry for like a few minutes, and then you come out of sleep and wake up. Well, stage 3 is actually where you want to get to, because stage 3 non-REM sleep is actually where the restorative processes in our body come from. That's when you get the regeneration of like the nerve fibers and the liver cells and all of these things that we need to stay healthy, including the regeneration of the cells within the gut lining. And so stage 4 is when we actually have what I call floppy sleep. So you've ever had a child and they fall asleep in the car and you pick them up and they're like a rag doll. It's like they're completely floppy. Well, adults rarely get to stage 4. That's a very deep level of sleep and deep level of relaxation that honestly is very hard for adults to get to. But the good news is you don't actually have to get there to get the restoration. The restorative processes begin in stage 3. And so I think the thing is, sometimes we think, well, I got 8 hours. Well, you got 8 hours, but they were all in stage 1. The drop of a pin would have woke you up out of that sleep, because our bodies never got fully rested. And part of that can be because of that adrenal fatigue type symptoms. That's actually one of the symptoms of adrenal fatigue, poor sleep quality, because your body's so full of cortisol that you really can't wind down. And so you have to start looking at some ways to decrease that cortisol level first to be able to wind down. The other part of that is if your insulin levels tend to be kind of peaks and valleys, you may find that it's hard for you to go to sleep because you lay down and your cravings are kind of taken over. Because people who tend to have higher insulin levels running through their bodies tend to have consistent cravings. And so if you find that, every evening you have to have that ice cream or cake or, whatever your sweet treat of choice is, but you have to have that, it seems like, before you go to bed. Keep in mind that that's a sugar rush. You've heard we talk about that with our kids. Well, it doesn't change when you get older. It's the same thing. If you eat a sweet before going to bed, you're actually giving your body that little burst of insulin, which is going to have that same effect. It's like a sugar rush. And you're not going to get the same quality sleep as if you ate something that actually could help you go to sleep. Something that's actually more along the low carb range. Maybe pick a fruit like strawberries or, blueberries or something with a little bit of some type of yogurt or something with that as your nighttime snack. Something that's going to actually help your body wind down if you feel like you need something later in the evening.
And I love what you said about the quality, because just thinking about anything that could interrupt sleep or disrupt sleep, like I'll say, do you get 7.5 to 8 hours of uninterrupted sleep a night? Because anything that disrupts our sleep wakes us up, and then we have to start over in that stage 1, stage 2, and then we kind of hang out stage 1, 2, non-restorative. That's excellent. Amy, do you want to share a question?
I do, because Sandra, you mentioned gut lining. So it seems like leaky gut and just gut issues seem to be prevalent, and didn't know, can you speak into that? Is that a hormonal thing?
Not so much hormonal, I would say more in aligned with kind of the gut microbe system. It's kind of what's going on inside of your gut. Let's put it that way. There's a lot of things that can interrupt your healthy gut system. The stomach lining is porous. It's porous by nature. God made it porous because you've got to be able to suck nutrients out of the food and exchange toxins and all of those things. But sometimes what happens is there's certain behaviors or things that we've consumed that leads to an increased abnormality in the porousness of our gut lining. And a part of that can include things like antibiotics that you take, dietary ways that you eat. If you're not eating very many foods with fiber, and your bowels are in a way where they're either holding on to food for too long, in other words, you're staying constipated, or you're somebody who's over consuming laxatives because you think that's a weight loss system, and you're trying to just flush yourself out and do these kind of cleanses and things where you're constantly flushing your system out. You have to be aware that your gut lining and the bacteria actually within your gut, it affects a lot. It affects your weight loss. It affects your immune system. It affects your clarity, how well you think. I mean, it has such a huge effect because that's probably one of the biggest areas of our body. If you think about it, our bodies are very condensed. Well, the gut's kind of all balled up into that one area, but it's a very large system within our body when you look at it proportionally. And so one of the things, when you're thinking about like leaky gut and those types of, symptoms people mention, some of the things you want to be aware of: do you have a tendency to stay very bloated? Does your stomach always feel kind of full and uncomfortable? Are your bowel habits very irregular? 1 minute you have diarrhea, the next minute you can't go for like 3 days and you have to take something, because all of those are signs that there's something in that system that's not working properly. And, one of the things to always kind of think back to as well is, when's the last time you took any antibiotics? Have you taken anything to kind of re-regulate the microbes, the bacteria specifically, that are naturally inside of your stomach? Because there's some natural bacteria that your gut relies on. They're good bacteria. We always give bacteria a bad rap, but in the stomach, there are some good bacteria that you actually want to be there because they are actually protective. They actually help to your stomach and your gut lining actually work properly. And so I would love to hear Liz's take on this, since her husband actually, this is what he does. So I'm sure she's up on all the research on gut lining and leaky gut.
We so joke about this at our dinner table and when the kids were young. We just, it is so apparent in terms of people's regularity. And I love that Dr. Sandra mentioned this. And I have this wonderful handout that I actually got from the Ace Fitness magazine a couple of years ago. And I give it out to my patients because it is called Move It Out. And it talks about bowel regularity because Dr. Sandra, you mentioned this, it is so important. And things like the bloating and the constipation, and one of my nutrition friends said this, constipation is another epidemic in America. We talk about the gastrocolic reflex that our bodies were not, we were not given an instruction manual with our bodies, but there is a normalcy or a regularity that we do talk about. A bowel movement after each meal is stone cold normal. I'll tell my patients, because I have patients that come in and say, my family thinks I go to the bathroom too much. And then they're actually having a bowel movement after each meal. And I say, you're the normal one. And then they're because you could imagine that as Dr. Sandra was talking about, she talked about eliminating things, eliminating toxins, eliminating things that our body doesn't need. Earlier on, if we don't eliminate regularly, and it's not just urinating, it's defecating, then those toxins, they accumulate. And also it changes the flora in our intestines. She was talking about having normal gut flora in our intestines. That is true. Taking one course of antibiotics knocks out your normal intestinal flora for 4 weeks, at least 4 weeks. And if you got one course of antibiotics, say you have a sinusitis, you get another course because it didn't clear up, you are really altering your gut flora in the intestines. And it is hard to get that back. Whole foods, that helps. Some people take probiotics. I have a nutrition friend that talks about the word prebiotics. Instead of eating or taking a pill of the probiotics, prebiotics is the whole foods, that we feed the good gut bacteria so they flourish and grow, versus the not so good bacteria that take over when we don't eat a good diet. Dr. Sandra also mentioned about eating things that aren't as high in fiber. Just thinking if a lot of our proteins are from like animal-based things rather than plant-based proteins, we're not getting the fiber in those animal-based things, just saying. So things to think about, and that are pro-inflammatory, because with things like leaky gut and inflammation of the gut, we want to reduce inflammation. So again, she mentioned about whole foods, so focusing on that. So, and then the other thing on this little handout I give my patients is the form of the stool. That's important. There's something called the Bristol Stool Scale, and I have my patients look it up. Very interesting, graded 1 to 7, stone cold normal, because form is important. Some people could just have rabbit pellets and they say, I go every day. That's still constipation. But a normal form on that Bristol Stool Scale is 4. What is that? The consistency of soft serve ice cream. You'll never want to eat it again. So having a bowel movement after each meal, that's a normal gastrocolic reflex. You do that by increasing fluid and increasing fiber. And then also the consistency of the stool is good. And that actually could help with the bloating and the constipation. It could help with things like leaky gut, inflammation, all those things. Mind-body connection too. Emotions is in there. And I like that you mentioned that too, Dr. Sandra.
We had one question here specifically from Jenny. Yogurt and kefir, is that a good way to balance gut bacteria?
I like both of them. I do feel like kefir and yogurt both do have some probiotics in them that can actually help build up the gut lining. The only thing about dairy products is that, especially if, there was a little bit of conversation about autoimmune diets and anti-inflammatory diets. Some people are very sensitive to dairy products. So you have to kind of evaluate how your body responds to dairy. But if you don't tend to have an issue with dairy products, then yes, those can be some good examples. Things like sauerkraut, there's some things you would never think about as far as being probiotics. Like sauerkraut is one that I find that a lot of people don't think about. And honestly, we don't eat because we don't even know where to put it, how to even use it as part of our kind of probiotics. But honestly, just a little, serving on the side. A lot of the best sauerkrauts kind of come actually in your dairy section, not like the canned stuff. Like it's healthier if you can get it more in a natural state where it hadn't been canned and put through another process. But there actually are in your dairy section, or in the same section you would buy like meats and things. So look for that, because that's actually another type of probiotic that, a little serving of sauerkraut on the side, especially if you just had a round of antibiotics, like Dr. Liz said, and that gut's going to need some extra support.
Very good. Another one that we've received here live, I wanted to bring up. Someone says, I went through menopause at 42, which is 14 years ago, and she's still suffering with hot flashes and night sweats. And I bet she's not the only one here. What do you do? What helps with that?
Yeah, that one's a little bit more complicated because, the symptoms that are bringing that on, because we assume that it's all related to the estrogen progesterone cycle. We assume that because people went through menopause, but what if it's coming from the cortisol cycle? What if it's from actually a high cortisol state that person's in? Because we don't really know like her lifestyle. I don't know if she's a high stress, high energy kind of person who has other hormones that are in effect at the same time as the estrogen progesterone changes that occur. Some of the things, part of the issue, I should say, with some of the symptoms we get during menopause is because of that shift from a mainly estrogen state to a mainly progesterone state. That's most of the things that we're noticing. And the only thing to kind of keep in mind, there are some foods that help kind of build up our estrogen levels, support the estrogen levels naturally, soy-based products and things like that. But honestly, you still want to kind of be aware of just some of your own history. If you have a family history where most of the women have breast cancer within your family, you're not going to want to increase up your estrogen levels too high because that actually increases that risk. So if that's not something that is of great concern to you, then some of the natural soy-based things can be a way of kind of stabilizing that. Maybe switching from dairy to soy milk, or, even eating soybeans. They're actually not bad roasted as a snack, with a little bit of sea salt. So there's some ways of kind of adjusting that estrogen progesterone kind of level so that you get a little bit of that shift back up. And, that's one of the things I have quite a few of my patients do, is to do a soy-based snack in the evening, because that does kind of help stabilize some of those hot flash symptoms.
Great suggestion as well.
I agree with what Dr. Sandra said. And I just want to say, because I know that there are thoughts, although there's research about this, especially in some meta-analyses that came out with regards to soy and breast cancer. Is there an association of soy and breast cancer? And I would I'm going to say one thing, and you might hear different things out in the community, but I encourage you to look at the research, and I'll give you resources at the end, if allowed. But I had done a talk on soy. The chemicals are isoflavins in soy products, and there's different types of isoflavins, and some are protective. And actually, in these meta-analyses, and the last one was in 2018, looking at even Asian women who they eat more soy products than we do, they had a lower risk of breast cancer when they took all the studies. And meta-analyses are taking a bunch of studies and putting them together. Hopefully they're the same, lots of things and not too different in those studies. But when they looked, there was actually a reduction in breast cancer with regards to soy products. But I agree, because they can be protective estrogen receptor blockers with soy products, just saying. But I encourage you to look things up and talk with your own physicians. Nutritionfacts.org, all one word. Dr. Michael Greger does short video segments that reviews the literature and answers clinical questions like that. But like Dr. Sandra, I do mention, if patients can tolerate soy products, to do that, and it's helpful, phytoestrogens, as well as the exercise and eating and reducing the cortisol as you do.
Excellent. I'm always coming back with body and soul, of course. We're going to talk about fitness, and there are several questions that we did receive that have to do with adjusting my target heart rate zone. As we age, if we do the equation we all learned in high school health class, that heart rate target zone needs to come down. So we've got a question about, is it dangerous for me to be consistently above that as my chronological age number goes up? But also somebody asked about sweating. And as she ages, she's sweating less during exercise. So I wonder, can either or both of you kind of speak into the fitness side of those questions merged together?
Yeah, I think, when you think about your target heart rate, there's a reason why it why it includes your age, because there is a difference in how much stress and strain, how your body responds, I should say, to the stress and the strain physical activity. Physical activity is always good. I don't care if you're, 5-year-old or 105-year-old. It's always good because the body's not meant to be stationary. But the activity of a 5-year-old versus the activity of that 105-year-old has to look very different, because if the 105-year-old tried to do what the 5-year-old does, it'd kill them. I mean, just being realistic, that's if you just think about it that way. So when you are personally looking at your target heart rate may have been one thing throughout your 40s and 50s, and that's what you've always trained for. Now you're in your 60s and you're still trying to function at that same 40 and 60 heart rate. What happens is you're actually you're asking a heart that is time-wise older to do the work of a younger heart. And so you want to always keep in mind that if you're then asking your heart to do more work, you're also putting more strain and stress on the heart. And so the reason that heart rate oftentimes goes up higher is because your body is actually going from kind of a normal physiological type stress to you're getting into actually more of a stress response, a stress state. And so you don't ever want to kind of constantly ask your body to do that. It's one thing to your child rushes out in the street, you kick it into overdrive to run out there to grab them. That's a short burst of energy, quick stress response. Your heart rate's going to be through the roof. You don't want to have your heart doing that every day when you decide to go out to work out. Periodically having, we talk about HIIT therapy sometimes where, you have these high elevations in the heart rate, then you give it time to recover. I think if you're doing something like that as part of your weight loss plan and your exercise plan, I feel like that's fine because you are letting it recover. When you're doing prolonged periods at your target heart rate and you're persistently keeping it higher than the recommended range, it's like doing consistent HIIT therapy without the rest break. And whenever you get into those type of cycles, I feel like it's out of balance and you actually put yourself at more risk for it being harmful to your body than it being helpful.
That makes sense. So what about as we age, do we tend to sweat less, or is this just this individual? Is that a concern?
I have heard people say that. Honestly, I don't know of any medical reason necessarily why that happens. For some people, I think, especially as we get older, all of our hormones kind of shift. The thyroid hormone goes down as we age, kind of just naturally, whether you have hypothyroid or not. There's just a natural decline in it. And that's one of the hormones that greatly affects kind of things like sweating and kind of our response to that. So like I said, I don't have any scientific proof, but just in thinking about it, that's the one that tends to come to mind, that there's just the natural drop in some of those hormones that lead to sweating. Testosterone level, all of those things that have a tendency to lead to excessive sweating that we see in youth, all of those numbers are dropping as you get older. And so I believe that adds to it. The interesting thing about that as well, that can sometimes add to your heart rate going up is as people get older, they also tend to not drink water very well. Most people don't drink water, period, regardless of their age, not an adequate amount for their body. So they stay in a level of mild dehydration. And that mild dehydration, honestly, will keep your heart rate higher too. So if you find that your exertion doesn't feel taxed, you're like, my heart rate goes higher, but I don't feel any more taxed than I would, normally. Part of that could be that you're mildly dehydrated. If your mouth is constantly dry, if your hair is dry, your skin's always dry, there's something to that. Your body's trying to tell you something. And even if you think, well, I drink all day long, what are you drinking? Are you drinking coffee and Coke and tea? Because all of those tend to be mildly dehydrating. They're mild diuretics, so unless it's herbal tea with no caffeine. But, for the most part, you're wanting to make sure that you are consuming adequate amounts of non-caffeinated liquids. And preferably there's some water thrown in there somewhere, even if you have to do like the, what's it called? Fruit infused water.
That's
where
right.
you've seen the little bottles where you put some of fresh fruit in there and let the flavors soak out into the water. You just want at least a large amount of the fluids you intake to be primarily water. I'll put it that way.
Do we require more water, more hydration as we age, or does it really stay the same?
I don't necessarily think you require more necessarily. I think you just have to, it really depends on your body size. You want to continue to get enough that you feel well hydrated. Whenever I have somebody who tells me that, oh, I go to, I get up in the morning, I go to work, I urinate before I go to work, and I don't have to urinate again until I come home. I'm thinking that's not normal. In any sense of the word, is that normal? Because that person basically is staying dehydrated all day, and then is drinking probably a lot in the evening because they can tell that they're thirsty at that point. And the problem with that is sometimes the body, because we're not very attuned to what our body needs, sometimes people are overeating because they're just thirsty. Their body is the body's telling them, I need something, but it can't really say I need water. And so you just feel that need for something, and you may be consuming chips and salty foods because salt is how the body holds on to water. And so your body's telling you I need water, you translate that into I need a bag of chips. And because your body's saying I need water, you're eating the chips, and that gives you a little bit of a hold onto extra water, which bloats you. When in reality, if you just drink the water, you skip the bloating, you skip the chips, and you actually are giving your body what it really needs.
What about decaf tea? Somebody is asking the Q&A. Is that a dehydrator as well?
Well, even decaffeinated beverages have some caffeine, but it's less. So if you're going to be, and I honestly recommend decaf everything for everybody. That's just my preference. And I'll tell you why. Because with my patients, what I find is over time, just in how the world eats and functions now, I can see some of the healthiest people develop like elevated blood pressure because the level for normal blood pressure has dropped very low. We're wanting people to have 110 over 70s or less. And that is not most people. That is not the 120 over 80 used to be the normal. Now it's like, no, we really need to be less than that to protect the heart. So most people actually have kind of these borderline type blood pressures, and caffeine stimulates that. That keeps the heart rate up, keeps the blood pressure up. And then when you have someone who's been consuming regular caffeine for long periods of time, and you try to get them to transition into decaf, it's an issue. It's almost like trying to get a drug addict off of, heroin or something, because their body fights back. It's had so much caffeine for so long. And so in most of my patients, when they first come to me, our very first conversation, no matter how healthy they are, is can we switch to half calf? Can you, buy the little pods that say half calf? You go to Starbucks, you ask for half calf. They know exactly what you're talking about. It's even on the app. That's how popular that is, to try to start transitioning people from full caffeinated to decaf. And half calf still has that kind of robust flavor, those who love the full caffeine, but it has less, and you can then start transitioning over into more decaf so that your body over time you can keep enjoying those beverages without it having so much effect on you. So no, if you're going to drink something caffeinated, I definitely prefer decaf. And if you're doing tea, there's a lot of really great teas that are uncaffeinated. Most of the herbal type teas, not green teas, they're usually caffeinated. Black teas are usually caffeinated, but you've seen like the chamomile and like mint teas, things like that. A lot of those are no caffeine, not even decaffeinated, just no caffeine whatsoever. So those can be really great. If you like iced tea, which I live in the South, I like iced tea. I make my iced tea with chamomile, and it's amazing. If you've never done that before, try it, because the flavor of chamomile is so soothing. And then you mix it with stevia or whatever sugar of choice you like to use. And I use that as my iced tea, and it tastes amazing.
Great suggestion. Liz, did you have a follow-up a while ago?
I am looking at these these other questions. So thank you, Dr. Those were excellent answers. You know, Dr. Sandra, I wanted to ask a question from Kate in Zimbabwe. And I wanted to know your opinion as well as Kate. What supplements would you recommend for women just starting menopause? And I know there's controversy.
Yeah, there's so much loaded into that question because the supplement conversation assumes that we can't get it through food is the first thing. So let me just say that my preference usually with my own patients is not to give them more pills to take. I hate taking pills. So I kind of treat them like I treat myself. I hate taking any kind of pill. So I'm always looking at how can we do this without taking another pill or any pills. And so when I think about, the types of vitamins and nutrients that women that are getting older would be deficient in, I kind of start giving them some ideas of things that I think would help. The number one that I find that tends to, so I'll answer your question up front. The only supplement I tend to recommend for women consistently is vitamin D. And that is because I find that to be deficient in, I would probably say 80% of the women that I check. And looking at the research, it's kind of across the board, all countries is somewhere around 60% of people tend to be low in vitamin D. Now, why is that? Maybe we're going outside more. Maybe we're consuming less dairy. I have no clue, but it's consistently low. And maybe it's the quality of the foods we're eating. I don't know. But I check every female that comes in my office over the age of 50, and to date is up to 80% tend to be low. And we live in the South where there's plenty of sunshine. So I recommend most women take some form of a vitamin D supplement, just because it is protective of the bones. Now we found that it's protective of the heart. There's so many different areas of our body that we're seeing that a low vitamin D level actually leads to worsening of our health. So that is the only supplement that I consistently recommend. The other supplement the other areas of nutrients that I like to make sure women are conscious of are their B vitamins, because high stress levels tend to zap our B vitamins. And so, B vitamins are in a lot of the fruits and vegetables and different things that we eat, as well as you want to get a high amount of antioxidant type foods that are not a supplement necessarily, but they're still things that you want in your body to kind of break down the toxicities that are in your body, that are in your food, that are in your environment. And so one of the main things that I try to make sure that my patients are really aware of is if we can get more kind of fruits, vegetables, and even legumes, some plant-based versions of some of these things, because there's a lot of B vitamins in those as well, and try to make sure that at least, one meal or a day kind of is focused around that. So rather than taking a pill a day, which is kind of how we've been conditioned over, in our culture, I'm going to take a one-day multivitamin. Can we have a one-day meal vitamin that is kind of like all consuming of those things? And when you think about salads or you think about vegetables, this is where you get to kind of play around a little bit. Go in Pinterest, do a little bit of meal prepping with that. I know it's time consuming to do vegetables and things, but what I find works for me and my husband, who's a real health nut, really loves to make sure that we're getting all our stuff in. It works well to do like on Sunday or sometimes Saturday, have a tray, roast a bunch of vegetables, zucchinis and sweet potatoes and all the things. And you put them all into like these little meal prep trays so that you don't have to like make it a big, when it's time comes for that vitamin meal, you don't have to kind of think, oh, now what am I going to do to get, my Bs or, to get zinc or to get whatever it is I need. You've already kind of prepared for it. And each week can be something new. With meal prepping, you're putting together like 7 days worth of that. Well, I kind of look at it like this. If I gave you a vitamin to take every day, you'd be taking the same vitamin every day too. So for 7 days, you can eat the same, vitamin meal. The next week, try something different. Maybe the next week, you're going to have a berry fruit salad every day as your vitamin meal. Maybe the next week, you're going to have, something that you made in your Instapot. It can be different, but if you're having a hard time staying on track, meal prep it. So for 1 week, you're going to have the same vitamin meal, and then the next week you go to something different.
Excellent. Those are excellent tips. I like what you said in terms of Okay, trying not to take another pill, but going to a whole foods kind of approach. So that's excellent. There's a follow-up question too from Valerie. It says, is there a good time or way to take the vitamins D and B?
Yeah, I always say vitamins should go with a meal because that's how your body expects it to come into your system. I don't like really any pills on an empty stomach unless they're specifically made for an empty stomach, in which case your pharmacist should actually put on the label, take on an empty stomach. Most, especially when the form of vitamins, if you were normally consuming the vitamins, they would be being broken down inside of a meal. So I always recommend taking it with a meal. Like, for example, that vitamin D, take it right before you sit down for breakfast, right as you're about to eat your meal, so that as that pill's breaking down, is being broken down with your meal, so that your body actually extracts it the correct way, or all the hormones that would be activated within your body with food are being activated. So you get a natural extraction of that vitamin D from the vitamin.
That's excellent. Thank you, Dr. Sandra. 2 comments additionally I have for that. Vitamin B, it's a water-soluble vitamin, so that is a vitamin. It should be taken with a meal. And you urinate it out every day. It's water-soluble, so you will not overdose on vitamin B. Vitamin D is fat-soluble, meaning, and I've had patients do this, they take too much vitamin D. When we say it's fat soluble, that means that vitamin can accumulate. It can accumulate in your tissues. So you want to be careful with not overdoing it with vitamin D. I've had patients take vitamin D 5,000 international units daily, and I say, I better check a vitamin D because they might be too high, which we could run into liver problems. We could get liver toxic if we get too much vitamin D. So it's a window. It's a window. So be careful that you don't overdo the vitamin D. So you should talk with your doctor about where you should be and then testing to see where you are. Because
that's a great point, because that is one that you can easily test. Vitamin B and some of these other vitamins, you're going to have to go to a functional physician to even try to get a test, because a traditional medical doctor is not going to be able to get, unless it's B12, it's not going to be able to get your insurance to cover most B vitamin testing. However, D, B12, iron levels, those kind of things, those are very easy from your physician to get approved, based on, if you're having health symptoms that suggest those things are low. So, never be and I'll just say this because sometimes I find that patients have had bad experiences with their physicians not listening to them or not taking them seriously, or, different things along that line. I always say if that happens, you need to change physicians, to be frank with you. Because if you have a doctor you don't feel like you can have that kind of conversation with, you're not actually going to be getting the best health care that you deserve. So find someone that you feel comfortable asking those kind of questions to, somebody that listens to you. They may have to say no to a test. They're not going to be able to give you everything you want all the time, but if they're listening to you and they're respectful of what you're stating to them, they can explain to you why they will order something or why they will not order something, so that you understand. Because sometimes you may demand a test where your physician's like, no, that's not what the issue is. This is what I believe the issue is, and that's going to direct the test that they order. But if that's a person that you trust, then that should be okay in those moments.
Excellent. That's excellent. And Dr. Sandra, I just wanted to ask, just because some people might be thinking it, and I know there's been research out about calcium, and should average risk community dwelling women postmenopausal be on calcium? And maybe that's just a corollary to what you already said.
No, I think that's good to bring that up as a separate point. I only recommend calcium typically. I don't recommend it like across the board, every woman who comes into my practice over 50. However, we do DEXA scans. We do bone density testing to see where women are at. And if we find that a woman has, a low score on the DEXA scan and it looks like she's at high risk for osteoporosis, we will recommend calcium as part of her therapy. Or if the woman has already had a hip fracture, fell and had a hip fracture, whether or not her DEXA shows it or not, she already has some signs of brittle bones. And so, we'll recommend that. In general, I don't recommend it just across the board. As I mentioned, I don't like pills. And so unless someone just really needs a pill for that, normally what I recommend, if they don't have any kind of anti-inflammatory type issues, or, where they can tell that dairy is an issue for them, I'll recommend some of the dairy products that they feel like they can consume. Honestly, now quite a few of the non-dairy products have quite a bit of calcium added to them. We talked about soy milk that now has calcium and D in some variations of it. You can always kind of reevaluate how you're consuming it so that you're getting it more in your diet as well.
Mm-hmm. That's excellent. I totally agree with what you said. And then just along the lines of, women that are thinking about, should I take calcium or not? And the answer is not necessarily, not for average risk, just thinking about bone health. And we had a nice talk on this that Ruth Ann hosted previously, but just thinking lifestyle pill, exercise, plyometric type exercise, and strength training help with bone health. So when women ask questions about supplements, sometimes, I'll ask them, and the reason that you're taking the supplement, so we can get to that and focus on some other sort of non-pill or non-pharmacologic ways of getting them the results or the things that they would like. So thank you so much, Dr. Sandra.
I think with the few minutes we have left, I don't know that we could serve our population well if we didn't open the can of worms. Everything from, we've got a question here, low carb, high fat, to intermittent fasting, regardless of our age. But as we age, we need to eat a little differently sometimes. We move differently. We need to change our focus.
Let's
there's not exactly a question, but jump in there. And
yeah, I love that one. I think that's a good one to talk about because it's very popular in the literature and things right now. Both low carb or keto diet, it sounds like what this person's talking about. Some variation of something like that, as well as intermittent fasting. I'm going to separate those out because they're completely different things. I know that they are often discussed together because a lot of people do them together. Intermittent fasting in and of itself, I think, is actually good for most people. We talked about insulin level in the very beginning. Every time you eat, insulin is released. So it spikes when you're eating those high carb, high processed foods. It doesn't spike, but it still goes up when you eat even healthy foods, when you're eating that whole food diet. So we're talking about kind of, let's say, for example, it jumping to 100 with a high, with the bread diet versus jumping up to a 50 with a whole grain diet. So you always want to focus on those wholer grain, less processed foods because the insulin jump is smaller, but there's still a jump because you ate something. Whereas during those times of fasting, there is no jump. The insulin levels actually is able to go down and to stay at its kind of baseline lower level. And so when we talk about intermittent fasting, we're basically talking about what is the period of time that you eat, what is the period of time that you don't eat. I mean, that's the simple concept of it. So let's say if somebody wakes up at 8 in the morning and they have their breakfast at 8, and then they finish up their dinner at 6 and they don't snack, then they're fasting from that 6 p.m. till 8 a.m. the next morning. That's their intermittent fasting period. Now, most of the time when you're looking at intermittent fasting, they're looking at kind of how fasting actually has some positive benefits on the body, it talks about how some of the kind of disease cells in the body can be kind of eaten up. I'm trying not to use like autophagy and all these words that just kind of get real technical and medical, but it's like it takes away some of those dead cells and it helps to kind of redo some of the gut lining, and it helps to kind of improve the body in so many different ways that sometimes the research has shown that the shorter you make that feeding window or that time period that you're eating, and the longer you can stay into the fast, the more health benefits you actually get from it. And so most of the time when you're looking at intermittent fasting, they're looking at windows like eating from like noon to 6. So you have a 6 window eating window, or maybe from 10 to 4. So a very tight time that you're eating, and then you're fasting all of those other times. What fasting and eating window works for you? I say you have to kind of personally work up to that. I think most people would greatly benefit from like an 8 to 6 initial process. Not eating after a certain time period kind of trains your body to be in that fasting state, and then not, wake up the next morning, you break your fast. that would be the kind of the general guidelines I tend to give my patients as far as starting off with intermittent fasting. And it's very natural because it's when you're going to sleep at night. So in the evening times before you go to bed, you could have something like that. Drink your water, have some chamomile tea, have something that's, that keeps you busy without actually having you consume nutrition and food. And so that's kind of a natural way of doing that. And if you wake up at 8 the next morning, that may be the beginning of your fasting window. However, if you're not hungry, we have to learn how to start being more intuitive in our eating style so that if you wake up at 8 and you're not hungry, don't eat. Keep pushing their fasting window. And what I tend to find is most people, when they first wake up, they are not hungry. They can actually push that fasting window back to 10 and have that first coffee or meal or whatever it is that they're going to have at 10 o'clock. So now their eating window is from 10 to 6, and they're fasting all at that other time. And you just keep pushing that back as your body kind of gets more comfortable with what it needs and the time frame it needs it. Now, what makes that easier for some people, because you might be thinking, well, I wake up hungry. I wake up, in the morning ravenous. I'm starving, That typically means that you're staying on higher carb foods, because the higher the carb intake, the more food cravings you have. If you ever notice, you might be on a great diet plan, you break it for one day, you have like a brownie or something, then it's like you've woke up every hunger cell in every part of your body. That's why that insulin spikes shoot off a carb craving, and it's hard to break that. And so the way you break that is with kind of forcing the body back into a low carb diet. And so the thing with keto, the thing with the keto diet that I don't have an issue with it short term. I think it can be beneficial short term for people to get their carb cravings under control, kind of help their body regulate some. It's very hard to maintain as a consistent lifestyle. At some point, you have to start adding back some healthy carbs, especially as a woman, because your estrogen and progesterone levels actually need some carbs for it to actually function properly. And so you have to recognize that even if you do a keto type, which is a very low carb, very high fat, moderate protein type diet, that can't be, you can't in your head think I'm going to do that forever. There has to be some modification so that you start adding more healthy carbs, downgrading some of those proteins and fats so that you're balancing out your macronutrient levels between that. There are some really great eating plans out there that balance this out very well. Some of you may be familiar with two ladies, I can't remember their names right now, but they have a company called Trim Healthy Mama. If you've never looked at some of their information, it's very interesting because what they did was they realized that the keto diet wasn't going to be a lifestyle they could continue, but they took elements of that low carb type eating style and added in permission, because it feels like you don't have permission to eat carbs on keto, permission to have what they call an energy meal, which is a whole food carb rich meal as part of that dietary plan. And it's planned out in such a way so that you keep your levels very low, your insulin levels low, while still maintaining the freedom of being able to eat some high carb, high nutrition type whole foods and still get the benefit of a baseline low carb diet. And I think that's the key to any lifestyle that you're going to be able to do for life, eating style, is that there has to be some level where you feel like there's some freedom. And if you're on a plan, like keto or something where you never can have certain things ever, it's going to start feeling very restrictive. And our natural nature as humans is to fight back against anything that's putting pressure on us, like restriction. You're going to want to feel freedom at some point in time. And so any plan that allows you to have the freedom to choose is going to be much more successful in the long run.
At Body and Soul Fitness, we talk a lot about consistency. You've got to be able to find that exercise activity, that nutrition plan that works for you. And we've got to be able to do it again and again and again. The key is consistency. So you're speaking our language. Excellent. Well, I hate to cut this off, but we have been going an hour. We knew this would be a rich session with both of these physicians. I want to thank you both for taking the time and being here on a work day. It is recorded, so those of you live can go back and listen again. We're glad that those that received the recording and are listening for the first time, we're glad that you were able to plug in as well. Any parting thoughts? And maybe, how about I put Dr. Liz on the spot and you share with us your parting thought before we hear from Dr. Sandra one more time.
I wholeheartedly agree with everything said in the chat and has been talking about that I call the lifestyle pill. So I agree with, I don't like taking pills. So when a patient comes in saying those things, what kind of pill or supplement or what can I do? There is power that we have. God has given us and put his power in us to take control over these. There are things that control, but I love these elements Sandra was talking about today in terms of the lifestyle pill. Good sleep, so good quality sleep, stress management, and that's what you started with, stress and beyond. Good nutrition, exercise, and lately I've been adding in relationships with that too. Just in the pandemic, I've seen how isolation and lack of relationships can affect our health too. So thank you, Dr. Sandra, for all of your comments and wisdom.
Oh, it was a pleasure. And thank you so much, Dr. Liz, for your feedback and your conversation as well. And just in closing, I would just say this, be kind to yourself. I know over this past, 18 months, most of us, even if you were on a fantastic plan before, I mean, the world fell apart and a bit of us fell apart too in the process, I think some. So if you gained 20, 30, whatever pounds during the pandemic, don't go beating yourself up. Don't go hiding behind stuff. Don't stop going to your exercise class or stop hanging out with friends because of that. Be kind to yourself. We have to have grace for ourselves like we would for our friends. You wouldn't shun your friend if they gained 20 pounds. You would still love her just as she is. Do the same with yourself, and then give yourself grace to be able to take the baby steps to get back on track. Thanksgiving's coming up. You may have, a piece of whatever it is. Don't feel like you're a failure if that happens. Give yourself grace. You can always start again the next meal. That's the beauty of diet and exercise. You don't even have to wait till the next day. You can always start with the next thing that you decide to eat. And so just give yourself permission to be able to fall off, so to speak, the wagon with the grace to start back where you're at and not always feeling like you have to perfect it. You want to stay consistent. I wholeheartedly agree with that, but we're also human. And sometimes that consistency is going to falter. And so don't beat yourself up to the point that you don't allow yourself to get back on track.
Very wise words. Very wise words. Well, thank you, everybody. We will sign off now. Everybody registered will receive the recording so we can all benefit from this again. So everybody have a wonderful day wherever you are in the world. Keep moving, make those good choices, and offer yourself grace, just like Dr. Sandra said. I think that's a good parting thought. So thank you, everybody.
Happy